Hey everyone, welcome back to the show. This is the Neuro Wellness Podcast. I'm your host, Dr. Joseph Coppus, and today I'm fortunate to be joined by my guest, Dr. Tatiana Habanova.
Hello, thank you for having me on. I'm very excited to be on your amazing podcast. Thank you.
Of course. I'm really excited about this topic, and I know especially at least 50% of the population, if not more, are going to be very interested in what we have to talk about today, and that is female brain health.
Yes. It's a huge topic, actually. It's obviously 50% of the population. It's important too, but even if you're, a father or a brother, you have a sister, a mother, so it's important that we consider female brain health.
Yes. I think everybody is going to be able to appreciate what we talk about today.
Well, thank you for having me on and for bringing this topic to light and to give it some more expansion and awareness in the importance of female brain health. So I thank you and appreciate this opportunity for us to have this conversation with your listeners.
Of course. Before we get started, I always like to ask my guests how they got into the world of neurology, and then you in particular, how did you get so interested in female brain health?
Sure. Thank you. That's a great question. So I've always had a fascination with neurology ever since I was a little girl, actually. And I ended up getting more involved in sports and orthopedic and musculoskeletal kind of work. And of course, that led me to the world of chiropractic. And in 2006, I somehow developed viral meningitis. Literally out of nowhere, I find myself like now in the hospital with viral meningitis and trying to recover from that. And so that was really my first time I've ever had a brain injury or anything that related, to just really affecting the way I can perform. And it really took me a long time to recover. I had no guidance. The hospital was great. They monitored me, and luckily I was able to go home within about a week. And then I was home for about 2.5 months. And now looking back, knowing, what we would normally have done for someone in that state, none of that was given to me. And I had no idea that I was supposed to seek that information out. So upon recovering and finally be able to return back to practice and carry on in life, I dove deep into neuro, and it just became a huge passion to, first of all, learn more from not only myself, but just there had to be a better way. This wasn't going to be the way I was going to continue living, with just having challenges and being able to function at the level that I wanted to function, that I was accustomed to. So several years ago, I just dove in, with the Carrick Institute, and really enjoyed their training and educational process, and really just took it full on. And now I've developed what's called the Palm Beach Brain Center here in my area, which we're a concussion neuroperformance clinic. And my passion is female brain health, because I think sometimes, we're just not as represented at times. And I really don't want to have really anyone, in all honesty, but specifically any women, to have to go through what I had gone through, not having the guidance, not having access to the resources, not knowing what resources to even ask for or look for, and get into the right hands and offices of the right physicians and clinics that could really help, and really just kind of shrink that recovery time. Instead of being a 2.5-year process, hopefully can narrow that down a little bit more to maybe just a few months. And so that's really where it stems from, is a little bit of my own struggles. And I'm glad that I went through it. I learned a lot. And I'd like to be able to share that information for others, so they can just, stuff happens in life, viral meningitis, it came out of nowhere. Concussions, things like that come out of nowhere sometimes, and we're forced to have to deal with them, the sequelae. And it's important that we take care of our brain, and that we resume and bring it back to proper function as best as we can.
Right. So being a practitioner as well as a former patient, what have you found to be some of the biggest hurdles or roadblocks as a female versus maybe what a male might go through as a patient?
Well, I think when I think back of some of the challenges I experienced in terms of, you kind of recover and you get back to work and you try to carry on, excuse me, and have the same workload as best you can. And you realize, oh, this is really a lot of cognitive challenges. I didn't realize I was challenging myself cognitively, or all the eye movements that I had to do all day. Like, I tried to drive for the first time. That was a disaster because I didn't acknowledge the amount of eye movement that went on with driving, and that just taxed my brain within 2 minutes. So as we started to kind of return and we seem normal, that was, I found, I'm a solo practitioner, so I run a practice myself, and it kind of it's all on my shoulders. So as I tried to return back to life and also family life and all my responsibilities, which I was very happy to get back to because I wanted to get back to my life, I was just falling short. And nothing against no one, but family members kind of expect you to do the things you're used to doing, and carrying on with just household duties and responsibilities with my family and business responsibilities. And it was just really challenging. And I didn't understand why I couldn't perform or do what I felt I should be able to do. And I didn't have anyone to turn to or talk to or realize. So that was a struggle. And I tried to explain to them, I'm just tired, more tired than I used to be. I just can't work, 8 to 10 hours a day anymore. I have to break it up into smaller chunks and stuff. It was a little bit of an adjustment. I mean, thankfully we got through it, but it was hard. I had a lot of expectations that I put on myself, that I wanted to resume my life the way it was because I loved my life and I didn't really want to have to change it. And but I had to also respect what was happening in my brain and in my body. And if I try to over push and do more, because I was really determined that day that I was not going to have to take a nap in the afternoon, or, just have to reduce my workload, and that affects, financial income flow and different things. So there was a lot of different aspects. Many times, sometimes my husband just wouldn't know the struggles I was having, and I kept it silent, and just would just go and maybe have a little silent cry and kind of get it out, and get a little downtime. And then I started to put a plan together and started to organize things more effectively and efficiently, and now I can manage things so much better. I've also done some brain rehabilitation, so I'm not struggling with some of the things I was struggling with before, not realizing I need to do some brain-based rehab to improve certain pathways, improve my eye movements and various things. So as I did that, I started to become empowered. I started to understand why I was struggling the way I was struggling, versus thinking, it's just me, I just don't have it anymore. Like, you kind of beat yourself up a little bit, you lose your self-confidence, you start to feel, it's a little bit frightening, I think, a little bit. You think, oh my gosh, I'm still very young, and I'm not really performing or functioning as well as I can at this age. What is that going to mean? So I think sometimes the emotional aspects, I think it could be spoken about and supported, and game plans put together to help navigate that process and the healing, and getting the family members involved so everybody can understand. It's hard when it's a silent injury, right? That invisible injury, and you look normal. There's many days maybe you are yourself, and so it's difficult for the outside world, family members and friends and maybe clients or patients, to think that you're different. And I'm so glad they never saw me as different. I'm kind of glad that they held the expectation of me, or, in their own minds, to have me back the way I was, because it did make me have to strive for that. Just in the beginning, I was just kind of coming up short a little bit, and had to kind of work through that.
Yeah.
So, yeah.
Well, I'm glad you brought that up. I think that's one of the things that almost all TBI sufferers mention, is it's so hard to convey what they're actually going through, because, like you said, it is an invisible issue. So having an empathetic support system is so key to that healing process.
It is, yes, very much so. And sometimes it's hard for another person to understand, like prior to me having viral meningitis, and then down the road, I had 2 concussions after the fact. So that was interesting. But I would have never thought that moving your eyes could create so much discomfort and pain,
Right.
or disorientation. I mean, not that one was being spun around and then you're a little disorientated, but I mean, just literally like moving your eyes, scanning a room, and you're like, whoa, and how fatiguing that could be. I would have not myself have appreciated that. I would try to be listening to someone and try to understand what they're saying, but I had no experience. So it can be challenging for family members and other people to be able to give that compassion to the same level. Yeah,
Yeah.
just an
Yeah.
open heart. That's all we ask for. An open heart, an open mind.
Also the world's problems. Um, so obviously you and I treat a lot of patients who are dealing with concussions.
Yes.
Looking just bird's eye view, I know I have a lot of specific questions
Okay.
about health and concussions that we've discussed, but just bird's eye view, looking at maybe a female versus a male concussion. What are some things that you need to just be aware of and take special precaution with when you're considering a female who sustained a concussion versus a male?
Sure, that's a great question. And there's more and more research being done on females and concussed females. So that's nice to see, because most of the research and approach to treatment, we're having to use research that was done mostly on male patients. And so a majority of the treatment protocols that are standard are applied equally to both of the sexes. And we do know, and there's literature out there to support this, that females respond differently to concussions. Obviously, each concussion is unique on its own. And even if the same person had 1 or 2 or 3 concussions, each concussion itself is still very unique. So we do have to keep that in mind, and a personalized brain health assessment or concussion assessment each time is important, to say the least. But the biggest aspect we do have to consider is really, when did that concussion occur in the cycle of the woman, in her menstrual cycle. We do know that there are different effects when there's the concussion in the first half of the cycle versus the second half of the cycle. And again, just based on the different hormones that are present in the body, they'll have different consequences and different effects. So that's one thing I think practitioners or physicians, anyone treating a female coming in. A lot of times we'll also see concussions with young female athletes, right? So soccer players heading the ball and things is like a common example. So these are, gals that are, in their teens or in their puberty, years and things. So those are the things that we do need to be mindful of what's occurring and how that can have a sequelae, possibly in their hormone production, just because of structures that are in the skull that produce the hormones, how that may affect further down the road. So monitoring missed periods or skip periods, and just sort of what is occurring in their cycle after the fact also is a good indicator of what might be going on. But we do know that women take a little longer to heal from their concussions. Again, everyone's unique, so it's really an individualized program. But in general, we do know that we need to approach brain care or concussion recovery programs different for females than men.
Hmm. Yeah, absolutely.
Mm-hmm.
I'm glad that you mentioned the cycle, the time of month that the woman sustains the head injury is so important to overall outcome too, I think.
Okay.
So females, I would say one of the biggest questions I get from my female patients who are currently recovering from concussion, especially those who have been in the recovery process for a long time.
Okay.
One of the biggest questions I get asked is it safe to become pregnant while recovering from a TBI?
Okay, so we have a female who has post-concussive syndrome and hasn't had any brain-based therapy, or is still in the process of maybe just recovering from the original the concussion that occurred maybe a year ago or something of that nature.
Yeah.
Right, right. So that's a really good question. when I did a little literature search, I just wanted to see what was the latest and the updates. And still at this point, really the consensus seems the literature supports that it is safe and okay. There shouldn't be anything hindering the woman from being able to become pregnant. So there are some research showing, though, that what can happen after a concussion, and specifically this research was actually targeted to females with TBI, so that was really nice, showing that there is a change, just again, in just sort of how hormones are being produced because of the pituitary gland that sits in the skull, and it can sometimes get a little injured and change its function. And that can have a kind of a sequelae effect in the hormones that for the woman. So they're showing that actually that could cause a dysregulation in her interest in having sexual relations. So they're starting to see evidence of just not as much interest or missing social cues. So again, it depends on the concussion she's had. Obviously, a lot of people who have concussions end up having some frontal lobe related issues, and maybe now they start to have a little flat affect, or they're not picking up on the social cues as well and things like that. So there was a few indicators explaining maybe why there is a decrease in sexual interest, possibly. And they're saying that it could potentially lead to some, sort of infertility issues, in the sense that she's not as inclined, to do that. And maybe possibly at a global level, seeing just a drop in fertility overall. So I thought that was a very interesting study, but it is safe. There's nothing wrong if a person went ahead and chose to become pregnant. The thing to think about, though, is being able to get pregnant and then sustaining the pregnancy, of course, and then most importantly, when the child is born, then the parenting part that's involved. And so someone who's going through post-concussive syndrome could have a few things going on in the different categories as cognition or behavioral, memory. So as they're continuing to rehab and improve, so that they can prepare their minds and their brains, to start to handle the little one, because, babies are a lot of work, and they're messy, and you have to remind them a bunch of times to do this and that. So sometimes the parenting part can be a little more challenging if one hasn't done maybe some of the brain-based therapy on the front end, so to prepare themselves for that time. There can be also maybe a little more fatigue that could occur. So naturally, pregnancy can be fatiguing in certain trimesters, and it can be hard for a post-concussive a patient to know, is that a brain-based fatigue going on from my concussion, or is this just normal hormonal pregnancy tiredness, right? So that can sometimes be a little challenge trying to tease out what might be going on. But I think the most important recommendation I would have for this person is to really work with your practitioner. If you're working with someone that they're going through an appropriate concussion recovery program, their OB-GYN, is probably involved as well in terms of monitoring the pregnancy, to really work together as a team and to create some game plans and, to kind of help as they're going through that process, but in preparation for when the baby comes. So they're ready.
Well, I'm glad you mentioned maybe not the pregnancy needs to be the concern, but more so maybe the parenting, and then how that's going to exacerbate symptoms and that sort of thing.
Yeah.
You had mentioned sexual interest and some sexual dysfunction, as well as along the lines of maybe hormones being dysregulated. In addition to that, I know a lot of times after concussion, patients often present with different variations of dysautonomia.
Yes.
How does that play into sexual function and interest?
Sure, absolutely. Well, so dysautonomia is a dysregulation of an area of the brain called the brainstem, and this area is important and commonly vulnerable to concussion. So it is very normal for this area to be affected, and there could be a variety of sequelae, and one of that being is a dysregulation of the autonomic nervous system, which is the part of our bodies that do our heart rate for us and our blood pressure and things like that, but also hormone production release, gastrointestinal function, bladder bowel functions and things. And one of the things that we also know is patients that tend to have dysautonomia will also have diabetes, that there tends to be a correlation there, that at some point they will end up developing diabetes or, blood flow related issues as well. So when we're looking at the sexual interest part of things, right? So not only do we have changes maybe in hormones, but also if now from just sexual interest and pleasure, if we're having a change in blood flow and circulation, that could really affect orgasms and things like that. If we're having sugar handling issues and we're becoming diabetic, now we're starting to also have related cellular function issues as well. So I think from a dysautonomic perspective, this is important not only for sexual function, because that is considered a biomarker for health. So the World Health Organization has seen that now as a marker that should be evaluated in terms of someone's satisfaction, in that area of their life. And when there isn't satisfaction in that area, we're seeing more depression, loneliness, and things. So it really does affect a person's mental and emotional well-being. So I think addressing the underlying dysautonomia and knowing there will be maybe, we always say if there's cold hands, cold feet, there's a cold brain, right? So if we're having blood flow related issues, that might be affecting, for example, even in the uterus, right? So in acupuncture, a lot of times, I do some acupuncture as well as a chiropractor, but we're trying to warm the womb in that sense. So we're trying to bring some blood flow to certain areas, especially when trying to help women with infertility issues. So if there's a lack of blood flow in certain, key organs and areas, that's going to obviously affect function.
Yeah, that makes a lot of sense, and I don't think people always make the connection there. Uh, so, so opposite to my earlier question, instead of is it safe to become pregnant while recovering from a TBI,
Mm-hmm.
what happens if you're already pregnant and then you suffer a TBI?
Sure. That obviously that's a little bit more alarming in the sense. So obviously, anytime there is, the research says to us that anytime there's any level of trauma to the head, mild, moderate, severe, but even mild, sometimes just a little bump to the head and people don't really, consider it much, but then they might have some sequelae of concussive syndromes. That person should be immediately evaluated. They should definitely, if they need to go to the emergency room or go see their primary or their OB-GYN, they need immediate medical attention. It's considered now 2 lives that have to be evaluated, so the mothers as well as the fetus. So regardless of how further along she is in the pregnancy, kind of in the beginning, middle, or towards the end. But either way, so now the attending physician is having to look at both aspects, both lives, and the well-being of both of them. And it really just needs to stay monitored because anything at any moment could happen and change. So at this point, I feel that this person's going to be, highly monitored and made sure that everything's going to be okay. So let's assume that there's nothing of that nature, but there was a concussion that occurred while she was pregnant. So, it's really individualized. Obviously, we want to make sure that the mother's fine and the baby's fine. And at this point, the best that one could probably do is just to be monitored, to follow the advice of any physician that they recommend, and probably to get some brain-based therapy so that sometimes little innocent symptoms may not seem a big deal day one, but added up, next thing you know, when you have a brain pathway that is not as healthy or functioning as well as it could be, as each day passes, it doesn't get stronger on its own. So now 30 days, 60 days later, we're in a completely different place and space. So I think it's important that the team is put together from the OB-GYN, maybe the primary care physician, a concussion specialist, and really address this.
Hmm. I agree. Um, Follow-up question. We talked a little bit about hormones
Mm-hmm.
throughout this. podcast so far. Um, is there anything that someone should be concerned of? Um, oh, Following up to that, we've talked a little bit about hormones in this podcast so far, and we know that hormone balance, it's such a delicate balance, and it's little things like a concussion can throw off that balance, or the wrong
Yes.
type of diet, whatever. Um, is there more of a concern if, especially a young woman, were to sustain a concussion during her pubescent years, during the time that she's going through puberty, um, later on in life? Does that affect kind of her hormone balance and her development later on?
Yeah, that's a wonderful question. And that's actually a question that gets asked quite a lot, and not just from young females in the pubescent years, but even women, later in their 20s or 30s and things, because it can have an effect. And I think this is an area where more attention and focus is needed, and also monitoring to be done. So what can start to happen is, we know within, the literature says 24 to 72 hours of a concussion, so a mild traumatic brain injury, right? So a little bumper blow to the head, okay? So not a major car accident, even just minor things can cause a dysregulation of the gut lining. So we already know within 24 to 72 hours, they're seeing evidence that the tight junctions between the cells and the intestinal lining start to kind of open up and separate, and you create what's called sort of like a leaky gut or a hyperpermeability syndrome. We also know now, with much more work being done on the gut brain gut axis, that all our barriers, so we have a blood brain barrier, we have the gut barrier, we have a sinus barrier, lung barrier, so we have all these different barriers in the system. They all start to become a little dysregulated or leaky, if we can use that word. So this term leaky brain, leaky gut type of idea. So just some loose terminology, but we're starting to see that there could be a breach to the blood-brain barrier. There could be a breach to the gut barrier. We know the enteric system is another level of part of our nervous system, that communicates between the brain and the gut. So what can happen at any age when there's the concussion? Now we open the door for, gut related imbalances. Now we might even be bringing up more inflammation up into the brain, in addition to the inflammation that was occurred from the concussion, and that sequelae of spreading that occurs, right? So we've got to kind of deal with the concussion. We've opened up another door now where we're creating this sort of leaky gut. And what can happen if the gut biome is not brought back into, restored back into health. And of course, this is all personalized medicine. So this is really a one-on-one conversation to have with each person. But the general idea is that now, if we're eating foods, something gets into the GI tract, it can get into the bloodstream, and now our immune system is responding to that. And down the road, we can end up developing an inflammatory, and then at some point autoimmune. So it might flip over and actually become a full-fledged autoimmune condition. And we're definitely seeing a definite rise in autoimmune conditions. So yes, it does matter. So definitely it's important that if there's a concussion at any time in the woman's life, but definitely, as she's younger and growing and developing, right, we want to make sure that from a gut perspective, that we're not setting her up for an autoimmune condition down the road. Yeah, and we know that that could definitely then affect her abilities to become pregnant. Let's say that this happened in her 14, 15 years old. She's thinking maybe of starting a family mid to late 20s, let's say. So there's like a 10-year gap. So now, if it's not addressed, that's a pretty good time frame that potentially there could be another underlying current happening that a lot of times people just aren't even aware of. And then down the road, she'll start having some of those autoimmune symptoms, and we'll start to wonder what's going on. And at some point, there'll be a diagnosis. And this is sort of that common trend, right? So I think bringing light to that conversation ahead of time, and implementing, gut healing strategies, and bringing in a little bit of functional medicine approach to a concussion management program, or at least a conversation, and then link the patient up to someone who works on that area is huge. So from the gut perspective, those are things we have to think about as postpartum, right? A lot of women afterwards will have postpartum depression and various things. We also know that when there's the concussion and there's the effect of the pituitary gland, okay, it's women kind of stress their hormonal system when they first hit puberty, right? So it's everything kind of dormant. Then there's puberty, so there's a bunch of action, and then it'll settle down, and then pregnancy is another kind of big stressor onto it. A good thing, but still an extra demand into the system. And then when there is menopause down the road, right? So there's a few moments in a woman's life where there's just more increased demand. We know that sometimes when the pituitary has been affected and maybe hasn't quite fully recovered and becomes hypo in function, so now it's sort of down regulated and not quite doing what it needs to do. So there'll be like a sequelae effect downstream of the hormones. Then when it's time, then there's a concussion, right? So that's happened, right? And then when it's time for her to have a pregnancy, to be pregnant, the ability for the pituitary to produce the job it needs to do is not possible. It just can't handle it. So it's sometimes it's almost like a second impact syndrome in that sense, where we're asking now the performance of the body to do something, or the pituitary to do something, and it just really can't. And that's where we start to open up the doors for just a lot of other failures to occur. So again, we just have to be mindful of what happens on the front end of a concussion and all the sequelae, and try to manage them or bring light to the conversation as best as possible.
So is it fair to say that if a woman is suffering from maybe infertility or endometriosis or PCOS, or the list goes on and on, which seems to be more and more common these days, is it fair to say that maybe she should look back at her history, whether or not she sustained a head injury at a crucial point in her development? And maybe she needs to then address the head injury and the gut that is the sequela of the head injury.
Yeah, that's a very good point that you bring up. And actually, I see that quite a bit. I'll see women that are, maybe now in their 20s or 30s, and they have PCOS, right? Which we know is a really underlying sugar handling related issue, right? Which is leading to infertility issues, right? But like you mentioned earlier, if there was a dysautonomia that occurred earlier in her life, sometimes they forget that they fall out of a crib, or they had a really bad fall when they were a kid, and at the time we never paid much attention about 20 or 30 years ago to it like we do now. So yes, it is nice to try to go back and remember if something happens. A lot of times the patients will not necessarily link the two together, and as a physician, I think we have to be careful not to just jump to conclusions, to say, okay, if you can remember there was an event in your past, maybe that set you up for a dysautonomia. Maybe that set up to become pre-diabetic or have underlying sugar handling issues. Maybe there's some other lifestyle and aspects maybe layered in on top of this, and now we have PCOS, and maybe now we're having some of the hormonal issues from that, and perhaps that could also be the underlying infertility related issues. That's why sometimes just a really integrative approach, well-rounded approach is sometimes the best way to serve the patient if possible.
Well, that's a perfect segue into my next question.
Mm-hmm.
You obviously work with concussion, and especially have a place in your heart for female brain health.
Mm-hmm.
How do you, as a practitioner, then take all these things we talked about today? Because
it's a lot.
a lot of complexity, yeah, that goes into this. So how do you approach these patients to assure the best chance of success for these people?
Yeah, so sometimes it kind of depends on how they're coming to me. If they're really coming to me to the office, for example, calling and asking for an evaluation because they're showing more brain-based related issues, so dizziness, headaches, light sensitivity, difficulty concentrating, things like that. Or are they coming to me because they are having infertility related issues, or their doctor maybe suspects autoimmune but can't quite diagnose it yet because maybe the blood markers aren't there at that moment or whatever the case is. So either way, I actually really still look at all the ways that different women come to me the same way. I still take an approach kind of like a functional neurology approach, so working through that lens of clinical neuroscience, as well as a functional medicine approach. And I do find that there's a lot of overlap between those two worlds, and patients really benefit from both aspects. Now, again, personalized medicine, so we're going to evaluate, and if there's a need to do more brain-based work up front, and then we work on the other functional medicine parts, because that could take more time. We know functional medicine can come around much faster. Functional neurology, so clinical neuroscience and brain-based therapy can resolve a little faster, and sometimes more lifestyle approaches, sleeping habits, nutritional habits, relationship habits. There's many layers that come into play, can sometimes take 3 months, 6 months, to even a year to work their way through. But I do actually approach it both ways. So it's a little bit more encompassing in that sense. Like it's good. It's a little more time involved. There's more aspects to it. So if a clinician is able to, bring that full circle to their patients, that's wonderful. Or to pair up with other practitioners in the area and co-manage and work as a team to help the patient, that would be great.
So, Dr. Habanova, typically when one of the biggest complaints that we might get with maybe the standard medical route is maybe they weren't listened to, the patient didn't feel like they were listened to, maybe they feel like they were given a cookie cutter approach. Why might it be important for a female dealing with these hormonal issues? Maybe they have the complication of the concussion. Why might it be important that they seek alternative healthcare practitioners such as yourself?
Yes, excellent question. It's true, the choices that women have in the typical medical model, especially when there isn't a medical emergency. So, the medical model obviously is fantastic and great for those things, and we want to utilize that element for that. But when it's like a PCS, so it's maybe something where she's dealing with for a long period of time, hormonal related issues and sequelae, and going through the typical medical approach is sometimes a bit limiting because there isn't much that can be offered from the physicians. Basically, they're going to probably just give her some birth control or some hormones or something, maybe to try to manage the cycle that way. And if they're not seeing a concussion specialist, if that physician's not trained, they don't really understand the sequelae and won't take the time to listen and understand. So seeking other physicians and other practitioners who specialize in areas, let's say, of functional medicine, in functional neurology or brain-based therapy. A lot of times, our practices are set up in a way where we take more time to listen, to find out what's really going on. Again, personalized attention, because each case is very unique and personalized. I see, several concussions like yourself, right? Constantly, and no two are alike, even though it might be, maybe similar reasons for the person. I see with a lot of equestrian athletes, so a lot of people are falling off their horses and, hitting their heads. So that happens all the time. But by being able to, seek a second opinion, let's say, or just to also bring in another physician who has the training and has the expertise in the structure of their practice, to be able to sit down, listen, dig deep, really find out what's going on, and be able to then basically create a plan just for that person and coach them and guide them and help them down through the process, as opposed to just come in for 5-10 minutes, here's your script, and out the door you go. And then there's no real follow-up or, conversation from that point. So the person's, again, kind of left on their own and there's no guidance. So I think really being able to partner up and get that other person involved in your team. I'm always about building teams and involved in that integrative approach. So sometimes it has to be on the onus of the patient to realize they need to seek out these practitioners and, give them a call, meet with them, talk with them, and, find out if there's a fit. Obviously, you want to make sure you fit well with the person that you're going to be doing some personal care with. So it's not just a quick little 2-second office visit. It's a little bit more of a relationship and a long-going ongoing relationship to see that through. So I highly encourage always to take that route. And there's a variety of different ways people in the functional medicine world or in clinical neuroscience approach brain-based therapy and holistic care. There's a lot out there, but to work with someone who's going to work with you.
No, yeah, I agree 100%.
Mhm.
We are just about out of time,
Okay.
Dr. Tatiana. But I wanted to make sure we budgeted enough time for you to give us any final thoughts on the topic, anything we may have neglected to touch on.
Oh, thank you. I appreciate that. Well, first of all, just thank you again for inviting me onto your amazing podcast. I'm a big fan, so I appreciate being able to share this time together with your listeners. And I think this topic is a really important one, and I'm so glad that you brought it, to your podcast. And it is an important area. I mean, I think a lot of times there's just not the literature or sources for women to know what to do. And even though the research is somewhat limited at this point, I know it's going to be improving over the years with more women being able to be test subjects, and we're having a better knowledge base. But until that time comes, there's many women that are wanting to improve their brain health. They want to have healthy, productive lives. So I think the most important thing is if you're someone who is struggling with, you may not know that they're brain-based related issues. You're not really sure if they're more functional medicine related, hormonal related issues. But I just, seek out, your office obviously is an amazing practice up in Chicago. I do refer a lot of patients to you guys because I do love the work you do. So definitely to reach out to quality physicians, to maybe call and ask friends if you're not sure who that is, but really trying to get linked up to good quality care. And I think that's the most important thing. And I think sometimes as women, we put other family members first, or we might sometimes, it's very common to, you're the nurturer. Yeah. So you try to just make sure everything else is okay. And many women will a lot of times put themselves on the back burner and say, oh, it's not a problem, I could deal with this, and kind of suck it up and carry on and struggle. And as much as I respect, putting other people's needs first, that's a very honorable thing to be able to do, and a selfless act. But at the same time, we have to be careful to let women know sometimes delaying care is making the situation worse, and you're deteriorating or degenerating or whatever. You're establishing, you're starting to create a bigger problem here by waiting. And sometimes making her the priority and giving her permission to say it's okay to go get help or improve or find the people you need to coach you, guide you, physicians, that are trained, that it's okay, that you matter, it's needed. And obviously when she's feeling better, she's gonna be able to serve her family and her life and her work much better as well. But I think a lot of times women will kind of put themselves on the back burner. So I think we have to give them permission to say, no, you got to go, sister. Let's do it.
Well, if any of our listeners wanted to reach out to you or come see you or check out any other resources, how would they do that?
Sure. So the best way to actually get a hold of me or to, get more resources is I have an online website that is a portal for other information. So it's just drhabanova.com. And I also have a Facebook group that is for women only. So it's a women only Facebook group, and it's all about brain-based related things. So it's a very supportive community. It's called Brain Health Savvy, which is on Facebook group, and you're welcome to join that. And it's a supportive community. It's a safe community. So we're really, really mindful of that, where someone can just openly ask questions and not fear about being judged or feel their questions too silly or be intimidated. We don't do any of that. It's a very high vibe community. So that's a resource if somebody wanted to pop in and ask some questions. I do regular lives and trainings just exclusively inside the group for the women there. And we have a variety of different women, with different brain-based related things. If someone wanted to come see me locally, I'm here in West Palm Beach, Florida, which is always beautiful, warm, and sunny. So, and my facility is called Palm Beach Brain Center. So they certainly can just look online at palmbeachbraincenter.com.
Perfect. And I just want to mention that you provided us with a beautiful kind of summary of everything we talked about today.
Little mini guide, yeah.
So we're going to try to have that available in the show notes if possible. And if we can't do that, just send myself. I mean, if you're open, send Dr. Habanova an email, message, and we try to get this guide to as a reference.
Yeah, or if they, I just put it online. So if they wanted to go to drhabanova.com/pregnancy, that's always available there. And it's in my resources on my website too. It's a free download. It's, I think, about 10 pages. And like you said, it's a summary of the things we spoke about today. So if somebody wanted to go back and maybe look something up and look something over, they're welcome to that guide.
Perfect. So maybe we'll link directly to your site in the show notes, because I don't know if we can.
It's probably easier because that way they can just download immediately, and you don't have to worry about trying to email people. It's crazy. So yeah, it's on the site. They can just download it, and it's instant download. So make it easy.
Awesome. Well, Dr. Habanova, this was fantastic. This was all I hope for and more. So thank you for being on today. I'm excited to get this one out. I think a lot of people are going to enjoy this one.
Oh, well, thank you so much for having me on your show. I'm very honored to spend this time together with you and the audience. And again, you guys are doing just such an amazing job with your podcast. I'm a big supporter. So please keep up the amazing work that you're doing. I know you're impacting so many lives, and so many more people need to hear all the messages and all the different speakers. You've had some amazing guests on the show, and I know you're going to continue to have some more amazing guests. So thank you for allowing me to be one of those guests today.
Yes, adding one more amazing guest to the list.
Thank you.
Thank you. And this has been your host, Dr. Coppus from the Neuro Wellness Podcast. Be well.